The U.S. Department of Health and Human Services is looking into reforming the organ donation system in the U.S. after a federal investigation found one Kentucky organization began the organ harvesting process on people who may not have been dead. A House subcommittee held a hearing Tuesday on organ donation safety lapses, some of those concerning Kentucky-based nonprofit Network for Hope, which merged with Kentucky Organ Donor Affiliates, or CODA. Tonight, we introduce you to TJ Hoover and his sister Donna. I spoke with her this evening. She says TJ was declared brain dead, but an attempt was still made to harvest his organs, even with doctors saying he was still alive. That's your LEX 18 big story at 11.
I'm your sister. Why? Mama decided that for us.
This is TJ Hoover. He has a traumatic brain injury and lives with his sister, Donna. He suffered an overdose in October of 2021.
You don't know about that? Well, we just have to deal with it, bub.
TJ was admitted to Baptist Health Richmond in cardiac arrest and was declared brain dead. After several days, his family made the tough choice to take him off life support and wanted to honor his wish to be an organ donor. So his family gathered for his honor walk before doctors took him to the operating room. But that's when the horrors started.
Almost immediately, as soon as his honor walk started, his eyes were open. And they were tracking, not just like, crazy eyes. He was actually tracking, looking around at the people that were there.
45 minutes after he was taken into the OR for organ harvesting, Rohrer says a doctor told them he'd woken up.
She said, I stopped it. He's not ready. He woke up.
But what Rohrer would later learn was much more terrifying. Natasha Miller was a surgical preservationist working TJ's case for Kentucky Organ Donor Affiliates, or CODA.
He was moving a lot, just kind of like thrashing, just not settled.
Miller says TJ's declaring physician thought he showed too many signs of life to continue with the surgery, but that CODA wanted to continue the procedure. Rohrer didn't know any of this had happened until she was contacted by Nicoletta Martin last year, a surgical preservation coordinator for CODA at the time, who'd been on her way in to take over TJ's case. She says she learned TJ woke up during his heart catheterization and his family was never notified.
I was really surprised that morning to see that he had been taken to the cardiac cath lab and he was awake, and they paralyzed and sedated him and continued on with the OR. And the case note said that the hospital staff was incredibly alarmed. They were calling it euthanasia. The cardiologist that was performing the procedure was saying that he didn't understand why TJ was given a poor prognosis, and to him it didn't look like he was brain dead.
Martin says she put her 2 weeks notice in to CODA after TJ's case. Rohrer says TJ suffers from PTSD every day from the trauma. And Martin, along with Rohrer, have been advocating ever since to get TJ's story out there and bring awareness to organ donation reform.
TJ was able to fight for his life, and he's still here. And there's others that are still here. But there's a lot that are not.
In Richmond, Annie Brown, LEX 18 News.
We reached out to Network for Hope for comment on TJ's case and on Tuesday's hearings. They responded with this statement that reads in part, quote, "We hold ourselves to the highest standards and are committed to ongoing improvement as we carry out the sacred responsibility of honoring each individual's decision to become an organ donor. We remain focused on our mission and dedicated to earning and maintaining the public's trust in the donation and transplant system," end quote.